The physiological responses to daily time-restricted eating versus intermittent prolonged fasting diverge substantially, despite both approaches limiting eating duration. Parallel group trials comparing isocaloric time-restricted eating, continuous calorie restriction, and alternate-day or multi-day fasting protocols with matched total weekly energy intake reveal distinct metabolic signatures. Understanding these differences clarifies which mechanisms drive specific outcomes and helps match interventions to individual goals. Daily time-restricted eating with 16 to 18-hour fasting periods produces minimal elevations in ketone body production when calories remain adequate. Beta-hydroxybutyrate levels typically remain below 0.5 millimolar throughout the fasting window in weight-stable individuals, insufficient to induce meaningful metabolic ketosis or its associated signaling effects. Insulin levels decline modestly during fasting hours, but rebound quickly upon eating resumption, maintaining overall daily insulin exposure similar to traditional eating patterns when total carbohydrate intake remains constant. Autophagy markers including LC3-2 and P62 show subtle changes in accessible tissues like circulating leukocytes, but the magnitude and functional significance remain uncertain without direct tissue sampling. These modest biochemical changes suggest that daily time restriction primarily affects nutrient sensing and circadian alignment rather than inducing the more profound metabolic state shifts seen with longer fasts. Prolonged fasting exceeding 24 to 48 hours produces markedly different responses. Ketone production increases substantially once hepatic glycogen depletes, with beta-hydroxybutyrate reaching 1 to 3 millimolar or higher, activating signaling pathways including AMPK and SIRT1 that influence cellular stress responses and metabolic regulation. Insulin falls to trough levels and remains suppressed, allowing maximal lipolysis and shifting substrate utilization toward fatty acid oxidation. Growth hormone exhibits pulsatile increases, potentially sparing lean tissue during extended energy deficit. Hunger hormone profiles differ as well, with ghrelin showing initial elevation followed by adaptation and partial suppression during multi-day fasts, contrasting with the daily ghrelin oscillation seen in time-restricted eating. These divergent hormonal milieux suggest that prolonged fasting may activate cellular pathways unavailable through daily time restriction, though translating these acute responses into long-term health benefits remains unproven. The practical implications guide intervention selection. Individuals seeking mild circadian realignment, modest calorie reduction through behavioral constraint, or sustainable long-term eating patterns may find daily time-restricted eating more palatable and maintainable. Those interested in deeper metabolic state shifts, periodic intense interventions, or potential benefits from ketosis and enhanced autophagy might explore prolonged fasting protocols, though sustainability and safety concerns increase substantially. Neither approach demonstrates clear superiority for common health outcomes like weight management or glycemic control when calories equalize, returning emphasis to energy balance as the primary determinant. The mechanistic differences matter for research questions and theoretical understanding, but translate into modest practical distinctions for most individuals. Clinicians should match fasting protocols to patient preferences, medical status, and specific therapeutic goals rather than assuming one approach universally superior based on mechanistic novelty or theoretical appeal.